sitting at dinner on a Monday night after feeling really good, getting exercise over the weekend, going to my aerobics class on Monday at noontime, and all of a sudden I felt like someone had stabbed me in the back. And I felt like the knife was going in and out, and if I just made one small body movement, I'd get stabbed again.
What happened was I was under a lot of pressure and pain. I was having excruciating pain in the shoulder blades, in the neck area, headaches. By the time I was driving home, I'd be in tears.
I would wake up in the morning with neck pain. I would go to bed with neck pain. I would grab my neck in the middle of the day and start tugging on my neck. I would say to my friends, "Can you rub my neck, please, please? I'm in such pain."
I went to the doctor and he recommended a spine stabilization program. And I went to physical therapy on the University Park campus.
Hi, I'm Donna Golar, and I work in the physical therapy department.
Hi, my name's Andy McDonald. I'm a physical therapist at the University Park Health Center.
Hi, my name is Jackie Dilla. I'm the Director of Physical Therapy at the University Park Health Center, and I'm here to tell you something about your back. Your spine has 3 curves, one that goes in, one that goes out, and another one that goes in. The upper one is called the cervical lordosis, thoracic kyphosis, and the lumbar lordosis. And your back is actually 10 times stronger with these curves in it than without. So the goal with all motion is to maintain each one of these curves as much as possible.
I thought that there was a big medical problem. I thought that maybe they could give me a prescription that would stop the pain. Maybe there was something swollen. They could give me some anti-inflammatories, and that would help recuperate. I didn't think they were going to send me to physical therapy.
Well, I expected what I've experienced in the past, which is a nice massage, a little heat treatment, a few stretches, and then I figured I'd be on my way. But it wasn't like that. The physical therapy department put me through like this workout, and I was sweating, and I was completely exhausted. And I learned more about my back and habits and maintaining good spinal health instead of just feeling good for a few days and then being on my way.
The number one causes of neck and shoulder pain and low back pain are poor posture and poor body mechanics with repetitive motion. Let's check your sitting position. Does this currently resemble you? If it does, let's make some changes. First, I want you to come away from the back of your chair. Good. Now, come up tall in your low back. Let those shoulders drop down and back, and pull your stomach in as tight as you can. See how this position maintains the normal curves in your low back? Hold that, lean forward, and scoot back in your chair. Good.
I finally went to see the doctor, and I was hoping he was going to give me a pill and everything would be better, but it was years of really bad working habits, sitting at the desk incorrectly, working at the computer incorrectly, and it all started to accumulate, and it was becoming really difficult to work. By the end of the day, I was in a lot of pain.
Now let's take a few minutes and evaluate your workstation setup. First, let's take a look at your sitting posture. We need to make some adjustments. I would like you to come up tall through the low back. Remember, shoulders down and back, and most importantly, stomach in. If you need some support throughout the day to maintain this posture, go ahead and take a towel roll and place it in your low back area in order to give yourself some support throughout the day. I'd like you to look at your chair height. I want the adjustment such that your hips and your knees are equal in height, or your knees are slightly lower than your hips. If your knees are higher than your hips, it is very difficult for you to maintain this upright posture. Next, arm position. Your elbows should come at a 90-degree angle and be close into your body, such that you need to adjust your chair or your keyboard to achieve this position. your mouse. If you're reaching out for your mouse, you're going to increase the activation in this muscle that may be causing you some neck pain. I want you to bring your mouse in close, such that again, your elbow is snug into your body. Now, when you need to reach for that all-important document, I do not recommend this. Instead, I'd like you to turn, face your target, square your hips up, reach forward to your motion, and pull. If you need to reach something that's away from you, such as the phone, a piece of paper, a pen, I want you to again, remember, stay up tall through the low back and move forward. Do not bend from the spine. Instead, stay up tall and reach. Keep that stomach tight. The most important part is the monitor. I want you to make sure that your eyes are not looking down or up. When you focus on the center of the screen, make sure that your eyes are in the middle of your screen.
I've made some changes in my work area. Instead of having my computer way far out and me reaching for it, I've brought it in closer to me and kept my elbows in at my sides. I've elevated my chair so that my arm makes a 90-degree angle. And I've really tried to focus on my posture while I'm typing so that my back's carrying the weight, not my neck and my shoulders.
Another common cause of low back pain is repetitive lifting using improper techniques. Improper techniques can include not bending the knees, rounding the low back, lifting with the arms, and twisting the body when placing the item on the surface. Correct technique includes getting close to the object, bending the knees, maintaining the low back curve, lifting with the legs, and turning the hips to face the surface on which the object is going to be placed. Use these correct lifting techniques for everything, lifting your backpack, laundry, groceries, books. Remember, it's not the weight that's going to injure your back. It's the motion. Every day and everywhere on campus, we see students, faculty, and staff demonstrating poor postural awareness. Let me show you how to adjust your backpack. A common mistake is the backpack is often worn up close, high on the neck and shoulders, causing additional strain in the neck, shoulder region, and low back area. The proper positioning is one such that the backpack is lowered down towards the waist. It allows the individual to stand more upright. There is a reduced strain on the neck and shoulders, and the lowering and the weight in the backpack will then cause the activation of the abdominal muscles.
I've changed my backpack a lot by really not carrying too many things in it. Before, I used to just jam everything I could into my backpack, and it would probably weigh about 15 pounds. Now it's a lot lighter than it was before.
A common mistake often made when carrying a briefcase or a purse is that either the purse or briefcase is worn on one shoulder. The shoulder is then elevated up toward the ear in order to support the weight of the briefcase or purse, making the shoulder height unlevel and a lot of tension in the neck and shoulder region. A solution to the single strap purse can be a double strap purse. Worn on both shoulders, the shoulders are free to relax down, they're equal in height, and she's ready to move about with her arms free. Both the portable office and the double strap purse are solutions that can assist in reducing neck, shoulder, and low back pain.
A friend of mine that has problems with her back, and I was talking to her the other day, and she has a prescription for physical therapy, and she said, where should I go? And I said, well, go talk to Jackie. Her methods are a lot different than any other physical therapist that I've worked with, but they're the most effective.
They saw how I was moving, they saw my posture, and then they developed a plan how to get me back into shape and pain-free.
Hi, Steve. My name is Jackie.
Hi, Jackie.
How
Thanks
are
for
you?
seeing me.
No problem. What brings you in today?
Well, I have a little back pain,
Okay.
like usual.
Back pain. Do you have any other problems that you're here for?
Well, neck and back.
You have both neck and back pain. Okay.
Yeah.
All right.
First visit, Jackie basically sat me down and pulled out an example of a spine and showed me all kinds of things that can happen when you have bad habits.
If you sit in a really slouched position, you stretch out the ligaments and you stretch out the muscles, and sooner or later you'll get symptoms related to disc.
So why is it more comfortable when we slouch?
Because it's inactive. Your body's completely inactive. There's no muscle requirement whatsoever. It's those little micro traumas over time of poor posture, year after year after year, that create the symptoms that you now have.
I told her, I said, I suddenly feel self-conscious that I'm not sitting right. She goes, well, this is the place to feel self-conscious. So we started by sitting up. She said, I want you to always be aware of your stomach being tucked. I want you to be aware that your shoulders are back and you have good posture.
I'm going to push down through your shoulders, okay, and I just want you to notice how that feels on your spine.
It's kind of tight.
Okay, now come up tall, right there. Now let me push down. What does that feel like?
It's a lot stronger.
Stronger?
Yeah.
Any pain when I push down?
No.
Okay, good. This is a position we want you to try and stay. I want you to stay up tall through your low back. Let your shoulders relax down and back. Okay, bring them down and back. There you go. There you go. In this position, the muscles associated with your neck and your neck pain are in more of a relaxed position instead of being forward where they're on so much tension, okay? So you really want to practice shoulders down and back, stay up tall. Now, the most important thing, I want you to think belly button to your spine.
Belly in.
All the time. When you sleep, you don't have to. But when you walk, you get out of the car, you go up the stairs, pull open a door, every time I want you to think stomach in.
Stomach in.
Now until you die. That's how long.
What if I can't breathe?
Okay? Now, this muscle is actually quite different from the muscle you breathe with. So I want you to practice, just pull in low, not so much that you're holding your breath, not with your chest, but just pull in here, good, just like that, activate it. When you're in the car, I want you to go in, out with your stomach. Now this muscle actually goes around and it attaches to your spine, it actually attaches to your back. Unlike the muscle that goes from here, from your sternum down to your pubic bone, it does not attach to your spine. And the muscle that comes straight down the front that everybody does with crunches, that does not help stabilize your back. Okay? So stay up tall, stomach in, relax your shoulders down and back. Now, this is the posture I would like you in all the time. Unfortunately, I don't think you'll be able to maintain that.
Try.
Maybe 6 months from now you will. Until then, I want you to get a towel, roll it up. When you get in the car, when you sit for a long time editing, whatever you do when you spend a lot of time sitting, I want you to place it in your low back area. Okay? Now it's going to serve two purposes. When you get tired and you slouch down, it's going to remind you, oh, I need to be up here. And also when you slouch down, it's going to prevent you from slouching all the way. Okay? So it's going to reduce some of the stress on your back. Shoulders down and back. I guarantee you will, sooner than later, feel a lot of tension
I do already.
and up and down the spine right here. And it's going to be very fatiguing for you because now I've asked you to use those muscles. In this position, there's not much active. No. I need you to be up here in this position to activate
And that'll go
these.
away after
We're going
a
to
while.
teach some simple exercises in order to improve your posture and increase your strength.
I say to myself when I'm walking, when I'm sitting, when I'm in my car driving, belly button to spine, shoulders back. I carry myself differently. And when I don't do it, I find that I'm not as comfortable.
And then she gave me exercises to do, exercises and stretches, and just said, do this for a week, 2 times a day, adjust your habits, take some kind of towel or roll and put it behind your back when you're studying and when you're sitting there in class. So I started to do all that.
The first exercise you're going to do is called marching. You're going to lie down on your back, and just like during the postural exercises, the most important part of the whole exercise is to bring your belly button back in towards your spine. I want you to squeeze the belly button in towards your spine, push your back down flat into the table, and I want you to march with your right leg so it comes about 2 inches off the ground, switch to the left. Now the most important part of doing this exercise is keeping the pelvis stable. I don't care if you do 2, I don't care if you do 30. I want you to do as many as you can until the muscles around your trunk fatigue and you can't hold it stable. And you'll know because your hands are on the bones of your hips, and as soon as you start to feel movement there, that's when you need to stop. I want you to spend 4 to 5 minutes a day working on exercises to help stay strong in the trunk. When you can do it the whole way through, if it's too easy and you're able to stay solid through your pelvis, the next progression, instead of just marching up and down, is to lift your leg and straighten it out and then come back and switch again, right, left, and I only want you to put your leg out as far as you can, keeping your back down on the table and your pelvis stable. The next step in the progression is to lift your legs up off the table so your knees are pointed straight up at the ceiling. And then from this position, instead of lifting up, I want you to drop your leg down toward the table. And again, switch right, left, right, left. And you can see, keep that belly button in tight. As soon as you start to lose it and you can't stay stable, then take a break. But I want you to, again, build so that you can do this holding the pelvis stable for at least 4 to 5 minutes a day, working on keeping that belly button in tight.
Before we go any further, are you slumping again? Sit up straight, stomach in.
The exercise you're going to do laying on your stomach is called the prone straight leg raise. First of all, make sure you put a pillow underneath your stomach so you don't hyperextend your back. I don't want there to be a huge curve in your back so that it's real deep in that direction. I want the same natural curve of your back so you can use a pillow to help support that. Again, hands are right on the hip bone so you can feel for movement of your pelvis. Your stomach is in tight, belly button back towards your spine the whole time. Then, holding that position, you're going to lift so your knee comes about 2 to 3 inches up off the floor. Hold it for a 5 count and switch legs. And again, you will alternate which leg you're going to, keeping your stomach tight and making sure that as you lift your leg, you can't feel the bones of the pelvis coming into your fingertips. That means that you're not holding it strong enough. When you can't hold it anymore, take a break. That means you're fatigued. Again, work on this exercise for 2 to 3 minutes. Stomach is nice and tight. Fingers are on the pelvis, holding for a 5 count, right to left, right to left.
The first exercises that I did looked initially like they were going to be simple, but when we did the repetitions, I realized I was going to be using muscles, particularly stomach muscles, that I'd never used before in my life.
The very first time, I have to be honest, I was, I don't want to do this, I want a pill, I want it to be over with quickly.
The first time I started the exercises out at home, I was totally exhausted. I've been doing exercises for years with weights and all kinds of stretching, but this was just exhausting. I really had to stick with it and not give up.
Now let's do some exercises to help decrease the stress in your neck and get strong between your shoulder blades. The first exercise is a stretch for the muscles around your neck. What you're going to do is take your hand and put it behind your back so that your shoulder is nice and stable. You're going to start by tilting your head away toward the side and down until you feel a stretch throughout the neck. You may have to tilt your head down a little more. It may be a little bit more to the side. Whatever position you can get into where you feel the most stretch through this area is just fine. I want you to hold that stretch for 30 seconds, 3 times, several times per day, anytime you feel tension in your neck. Now let's do a couple exercises to help you get strong back in between your shoulder blades to support your posture.
Then she stood me up and she had me lift 2-pound weights or 3-pound weights, kind of over my head. And I was exhausted. I'm used to lifting, 20 or 30 pounds, and I couldn't believe it. And she had me do 3 sets of 30 seconds.
As with the other exercises, the most important thing is to keep good posture. Your stomach is in towards your spine. You're going to start with your shoulder blades right out at your sides and your shoulder blades squeezed back together. Push up toward the ceiling, maintaining that position of your shoulder blades throughout. So you're just going to push up and down. 3 sets of 15 with whatever weight that you can find around the house. If you don't have weights, that's fine. You can use cans of soup or vegetables or whatever you have around the house that weighs a couple of pounds. If you start to experience any pain or fatigue during this exercise, go ahead and stop, even if you don't get to number 15. The numbers aren't as important as it is to maintain good form throughout. The second exercise you're going to do is called shoulder abduction. You're going to start with your arms extended at 90 degrees, your shoulder blades squeezed together, and lift up until you get to 150 degrees, and back down. And don't drop down below 90 degrees. Your shoulder blades are pinched back and together the whole time, and you're not letting these come up and pinch towards your ears. If you do, that means your muscles are fatigued. Stop and take a break.
And then I did the exercises, and they hurt, and it was hard.
In the beginning, I was thinking, this isn't going to do anything. But in reality, it was the best thing that could have happened.
For those of you who currently are not experiencing any symptoms, please use these exercises as a preventative measure. This is the key to a strong and healthy back. Remember, sit up tall, shoulders down and back, stomach in.
It was easy to be motivated because I felt such a tremendous relief. After a couple of weeks, I could feel that my movements were better, I was happier. I was a couple times coming home and realizing, oh, I'm not in pain.
After just a couple of weeks working with physical therapy, I've made better changes. I'm more aware of things. I'm more aware of my stomach hanging out and my posture and sitting up straight, and working on my exercises and stretching so that it's a life choice, it's a life change. It's not just a cure the immediate problem, it's getting to the root of it. And I think that's what's been great.
So I find that I'm more productive at work and on a personal level too. So it's really helped me out a lot. It's really helped me out a lot and made me a much happier person.
Now that you've had a little spine tuning, we hope that you'll be able to incorporate these exercises and postural changes into your daily life.
I have noticed more in these last few weeks than I have in the last few years.
Physical therapy has given me skills that will last me for the rest of my life.
Well, I think the most important thing, at least for now, is the backpack, really reducing the load. I know you're supposed to carry the little wheelie thing, but it's not really an option, so I just dump as much stuff out of my backpack as possible. The other thing that I've learned is when I'm in class, really sitting up straight, keeping my stomach in, and that works my stomach muscles beyond belief. Then I keep my shoulders in good posture. And then the other thing I do is I carry with me some kind of shirt or sweatshirt, and I roll it up, and I put that behind my back as a way of having some kind of support, so that when I do get lazy, there's something there to remind me, you're slouching, you're slouching. And the other thing I've learned is that a lot of people have terrible back problems, and it's because they're not sitting up straight, they're not holding their stomach in, they don't have good healthy backs. And I really want a healthy back, so those are the things that I've learned to help me do that.
We have a handout for you to take with you that will outline these exercises that we've discussed in the video. On behalf of all of us in the physical therapy department and the USC University Park Health Center, we'd like to thank you for sharing your time with us.